Common symptoms of borderline personality disorder, BPD, extreme mood changes and emotional dysregulation. One of the most prominent and challenging features of borderline personality disorder, BPD, is extreme mood changes and emotional dysregulation. These intense emotional shifts can happen suddenly and unpredictably, often without a clear trigger, making it difficult for individuals with BPD to manage their feelings. Emotional instability leads to profound distress for both the individual experiencing it and their loved ones. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore how extreme mood changes manifest in BPD, the underlying mechanisms of emotional dysregulation, and how these symptoms impact daily life and relationships. What is emotional dysregulation in BPD? Emotional dysregulation refers to the difficulty in managing or controlling emotional responses. Individuals with BPD experience intense emotions that can be overwhelming, leading to impulsive actions and rapid mood swings. These emotions often seem disproportionate to the situation at hand, making it difficult to maintain a sense of emotional stability. Emotional dysregulation is often linked to heightened sensitivity to external stimuli, such as conflicts in relationships, stress, or perceived rejection, which can trigger extreme emotional reactions. For someone with BPD, even small events can lead to large emotional surges, creating a sense of unpredictability and turmoil. How extreme mood changes manifest in BPD. 1. Rapid and intense mood swings. People with BPD often experience extreme shifts in mood, sometimes within hours or even minutes. For example, they might go from feeling euphoric or highly energized to feeling deeply depressed, angry, or anxious without a clear cause. These shifts are usually intense and can cause significant distress to the person with BPD and those around them. From happiness to despair, a person with BPD may feel elated or excited in one moment, perhaps due to a positive interaction or event, but then suddenly feel overwhelmed by sadness or hopelessness, often due to a minor trigger such as a perceived rejection or frustration. Mood swings based on interpersonal events. Most often, these extreme mood changes are tied to interpersonal dynamics, whether real or imagined threats to the person's relationships, such as feeling ignored, misunderstood, or abandoned by a loved one. 2. Feeling overwhelmed by emotions. The emotional intensity experienced by individuals with BPD can make it feel as though they are drowning in their emotions. For example, if they experience anger or fear, the intensity can be so overwhelming that they feel unable to function or think clearly. This can lead to impulsive actions, such as outbursts, self-harm, or reaching out to others in a way that may seem disproportionate to the situation. Fear of abandonment is a common trigger for these intense emotional experiences. When someone with BPD perceives a threat of rejection or abandonment, they can feel utterly overwhelmed by panic, rage, or despair. 3. Emotional vulnerability. Individuals with BPD are often highly sensitive to emotional stimuli, making them more susceptible to feelings of distress. For example, even a small disagreement or a minor comment from a friend or partner can feel like a huge emotional blow, resulting in a crisis of self-esteem and overwhelming emotions. Highly reactive, they may react strongly to perceived slights or feedback, interpreting neutral comments as criticism or rejection, and thus amplifying their emotional response. 4. Difficulty returning to emotional stability. After experiencing an intense emotional reaction, it can be extremely difficult for individuals with BPD to return to a calm state. Unlike those without BPD, who may be able to regain emotional stability more quickly after a distressing event, people with BPD often find themselves stuck in their emotional state, whether it's anger, sadness, or anxiety. This prolonged emotional response can create a sense of being out of control or trapped in one's emotions. Difficulty with recovery. The person may struggle with rumination, replaying negative thoughts or feelings related to the emotional event, making it harder to regain composure and return to a balanced emotional state. The impact of extreme mood changes and emotional dysregulation. 1. Interpersonal relationships. The rapid and intense mood swings often associated with emotional dysregulation in BPD can create significant challenges in relationships. Partners, family members, and friends may feel confused, exhausted, or frustrated by the unpredictable nature of these emotional shifts. The person with BPD may be seen as too much to handle or as overly demanding of attention and reassurance, especially in moments of emotional distress. O struggles with emotional closeness. The instability in emotions often leads to difficulties in maintaining stable relationships. Individuals with BPD may oscillate between idealizing someone and then devaluing them due to perceived slights or conflicts, leading to a push-pull dynamic. O fear of abandonment. Because of the constant fluctuations in their emotional state, the person with BPD may be hypersensitive to perceived threats of abandonment, which can lead to behaviors that push loved ones away, such as clinginess or outbursts. 2. Self-esteem and identity. Extreme mood changes often exacerbate problems with self-esteem and identity. People with BPD frequently experience a fragile sense of self, and the emotional turbulence they experience can lead to a sense of confusion about who they are. 1 minute, they may feel confident and proud, and the next, they may feel worthless or ashamed. Mood swings and self-worth. Because emotional regulation is so difficult, their mood swings can significantly affect their self-image. For example, they might feel empowered after receiving positive feedback or validation, but quickly shift to feeling deeply ashamed or inadequate when faced with a minor criticism or perceived rejection. 3. Self-destructive behaviors. In response to overwhelming emotions, individuals with BPD may engage in self-destructive behaviors like self-harm, substance abuse, or impulsive actions. These behaviors may be attempts to escape or numb intense emotional pain or to feel a temporary sense of control over their emotions. Self-harm. For some individuals with BPD, self-harming behaviors, for example, cutting, can serve as a way to release emotional tension or feel more in control of their feelings. Although these actions can provide brief relief, they do not address the underlying emotional issues and often exacerbate feelings of guilt or shame afterward. Risk-taking behaviors. Impulsive actions, such as reckless driving, unsafe sexual behaviors, or gambling, may arise as attempts to escape or distract from intense emotional pain. However, these actions often lead to negative consequences, reinforcing emotional instability. Treatment for emotional dysregulation in BPD. Effective treatment is essential in helping individuals with BPD manage emotional dysregulation and extreme mood swings. Several therapeutic approaches focus on emotion regulation and improving emotional stability. 1. Dialectical behavior therapy, DBT. DBT is one of the most effective therapeutic interventions for BPD, particularly in managing emotional dysregulation. DBT helps individuals learn mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. Through DBT, individuals can gain greater control over their emotional responses, build healthier relationships, and reduce impulsivity. 2. Cognitive behavioral therapy, CBT. CBT can help individuals with BPD identify and challenge the negative thought patterns that contribute to emotional instability. It encourages individuals to recognize and reframe distorted thinking about their emotions, helping them respond in healthier ways when faced with stressors or relationship conflicts. 3. Mentalization-based therapy, MBT. MBT focuses on helping individuals with BPD improve their ability to understand and interpret their own emotions, as well as the emotions of others. By learning to mentally process their feelings, individuals can gain greater insight into their emotional responses and reduce the intensity of emotional fluctuations. 4. Medication. While there is no specific medication for BPD, certain medications may be prescribed to help manage symptoms of depression, anxiety, or impulsivity that are often associated with emotional dysregulation. Medications can provide temporary relief, but therapy remains the cornerstone of treatment. Conclusion. Extreme mood changes and emotional dysregulation are core symptoms of borderline personality disorder, BPD, and they often contribute to instability in relationships, self-esteem, and overall functioning. These emotional shifts can feel overwhelming and lead to impulsive behaviors that provide temporary relief but ultimately worsen the individual's emotional state. Effective treatment, including DBT, CBT, and other therapeutic interventions, can help individuals with BPD develop healthier emotional regulation skills and improve their relationships. In future episodes, we will continue to explore how treatment approaches can help individuals with BPD manage emotional dysregulation and create more stability in their lives. Stay tuned for more insights into borderline personality disorder.